In a matter of days, the United Nations General Assembly high-level meeting on ending AIDS will begin in New York. The Society Against Sexual Orientation Discrimination SASOD project coordinator John Quelch is one of the representatives of a civil society attending the meeting, which will be touting the interests of the vulnerable community.
We're hoping to stimulate some sort of change with relation to the laws and regulations, policies that prevent these vulnerable communities. When I say vulnerable communities, I mean men who have sex with men, sex workers, and transgender persons, from accessing HIV prevention and healthcare services, especially at the healthcare facilities and systems around Guyana. Because of those discriminatory laws that are in place, a lot of those persons cannot seek the sort of attention that they need. So they most likely do not even access HIV prevention healthcare services.
Quelch is of the view that Guyana can learn from other civil society organizations and governments from around the world on how to combat the global epidemic.
Well, I'm hoping for our national delegation to adopt the recommendations from other civil society organizations, other civil societies from other countries, other governments, to at least engage in some sort of change discussion surrounding how we can remove these discriminatory laws that prevent the largest part of the HIV epidemic, persons affected by the HIV epidemic, so that these persons can have better access to services.
The local NGO over the last few months have been meeting with members of parliament on both sides of the House to share their concerns about issues facing the LGBTI community. The UN General Assembly high-level meeting on ending AIDS will focus on the importance of accelerating the response to HIV over the next 5 years. The goal of the meeting is to set the world on course to end the AIDS epidemic by 2030 as part of the Sustainable Development Goals. At the end of the meeting, UN member states are expected to adopt a political declaration. Mark Murray, Newsroom.